Today I'm going to talk about why we crown your teeth. Number one reason is after you have a root canal, the tooth is now a dead tooth. It's just in the mouth for aesthetics and there's no blood supply to the tooth. So you have to be careful because it's easy to crack and break. So with the crown, it reinforces the tooth and it protects it from cracking or breaking. Here are some other reasons. If you have a large filling, an old large amalgam filling, they usually expand, cause cracks on your teeth. That's another reason. Also, if you have a lot of decay in the tooth and by the time we remove it, very minimal tooth structure is left, then we build it up with a core and then place a crown over the tooth. Multiple cracks. If you have deep cracks, we feel it with our instrument, when we run the Explorer along the crack of your tooth, if we feel it, we say it's time to crown your tooth. If the cracks go beyond the crown surface and it goes under the gum, entering to the root surface, definitely get the crown done before the tooth cracks on you. The other one is a fractured crown. If the cusp breaks off, that's the biting surface of your tooth, if it breaks off, and minimal tooth structure, we crown the tooth. The last reason is if you have a cracked tooth syndrome, if you have large fillings with cracks, and then all of a sudden you bite on the tooth and you start to feel sensitivity to biting on a particular spot or to cold sensitivity, that's a crack. And if you see it looks normal, there's nothing wrong with the tooth, but when you bite down, whoop, there's the crack. And once you have this crack, if you don't do anything about it, this crack can carry on, go down to the root surface. Once it's on the root surface, you can't save the tooth, it needs to be pulled. So there you go, some reasons of why your dentist has recommended you to crown your teeth. I will show you some pictures so you get a better idea. Here are some fractures or cracks on the molars, which we recommend crowns. Here you see the deeper crack with a split on one tooth. A fractured cusp of the molar on this one as well. Then there's decay under a large filling, a larger filling with decay underneath it. This has gone really deep decay and large fillings. So there you go. That is the reason why.